Hi, everyone. This is Dr. Ruscio. I'm here with Mason, who's had really great results, and I almost don't even want to say too much and let you kind of tell your story because it's a great story. So, why don't you tell us a little bit about what you were suffering with, what you were told by other doctors, and then some of the results that you saw, and I'll chime in here and there.
Okay, well, I've been a healthy vegetarian for 40 plus years. And about 7 years ago, all of a sudden I was having trouble just with gurgling stomach, a lot of bloating, a lot of belching, and then at night starting to experience acid reflux in the middle of the night. I went to my general practitioner, explained what was happening, and the first thing he did is he prescribed putting me on Prilosec. And you're basically sleeping elevated, kind of looking for trigger foods, that type of thing. I found that the Prilosec really didn't help me at all, so I stopped taking that. Sleeping elevated helped a little bit. About 3 years ago, just to continue to go back to the general practitioner each year, he finally sent me off to a gastroenterologist.
Enterologist. That's a tough one.
And that gastroenterologist basically put me on a heavier dose of Prilosec. And what happened then is I broke out in a rash all over my body. And at that point, he said, well, obviously you can't handle that. So he put me on a pepsin drug, and that helped a little bit, I thought. After a while, that wasn't really working either. So I stopped taking that. And I just basically was trying to look for trigger foods, that type of thing. About a year ago, my condition worsened to the point where I'd broken out with a rash. I'd gone to 2 different dermatologists. The first dermatologist gave me a salve and said, oh, that'll go away. Second dermatologist biopsied the rash. The rash was in my scalp, on my chest, my back, on my ankles, and it was really miserable, real itchy. And he sent a sample off the lab. It came back that it was it's called lichen probus, I believe. And the dermatologist said, I'm going to give you this salve, which kind of desensitizes the itching, but for the most part, we have no idea how to cure it. And it's something you may live with the rest of your life. So I accepted that. But at that time also, I was really having a tough time with loose bowels, to the point where you'd leave home and you kind of figure if you had to use the bathroom someplace, where might that be? And it just got worse and worse. I watched a series that time called Interconnected. And in that series, they interviewed Dr. Ruscio and talked about his book. And I was really impressed with what I heard in that series. So I bought the book, and within 2 days, read through that book completely. Put myself on the FODMAP diet, and that helped about 30%. Then I got an appointment with Dr. Ruscio, met with him, and then he basically felt that my problem was that the doctors were prescribing medications to limit acid production, where in fact what I really needed was more acid in my system. So at that point, he put me on hydrochloric acid pills, and almost immediately all of my digestive issues went away. He had mentioned too that maybe as a plus that the acid would actually help with my rashes, and sure enough it did. Within about 2 weeks, I started noticing that the rashes were going away. Within about 2 to 3 months, they were pretty much gone. So that really helped, and the acid treatment has just been miraculous for me.
I want to make sure we don't forget to include this. You were saying that when you forgot to take your hydrochloric acid supplement, you noticed a pretty immediate reaction?
Let's say you go to somebody's house and you're having dinner there and you forgot to take your pills with you. Or just forget to take it. I noticed immediately that I'm bloating and gas and those types of issues. So I'm very confident that the HCl is really helping me with my digestive issues.
And that's a clear indicator, obviously, that it is helping you, of course. One of the things that I'm hoping that we'll get to in time is a little bit more resiliency. So you can deviate. And what I'm hoping will happen is right now, deviate one meal, you notice a change. 6 months from now, you deviate 1 week, you notice a change. A year from now, you deviate 3 weeks, you notice a change. So I'm hoping that your latency will become much more prolonged, or I guess however you want to kind of label that there. But that's another thing just to kind of keep in mind, that where you are right now, only being a couple months in, is likely at the same place you'll be 6 months, a year and a half. Just kind of as a note of encouragement, because it's great on the one hand that you're noticing this quick feedback. I'm also hoping that we'll get to a point where you can forget your pills and not have to really worry about it. And in addition to the acid, I'm kind of curious to have you share with people, we use hydrochloric acid supplementation, and this is something that I talk about in Healthy Good, Healthy You, which can be helpful. It's not helpful, like we talked about a moment ago. It's not helpful for everyone, and some circles on the internet kind of inculcate everyone into thinking that everyone must be on acid. And there's factors that we can look for, and certainly being 65 or over increases the likelihood that acid may be helpful. And the challenging thing is that reflux can indicate either not enough acid in some cases or too much acid in others. And that's a real kind of quandary, which is, well, how do we know? And really the best way to navigate through that is to do a cautious trial. And in your case, almost instantaneous improvement. So that tells you the acid is the right maneuver. But we also use probiotics and some gut soothing nutrients, our gut rebuild nutrient powder, and the vegetarian low FODMAP. And I believe you had been on the low FODMAP prior.
Yes.
So that wasn't a change from when you came in. But there was the acid, there was the probiotics, and the gut rebuild nutrients. Now it seems like the acid led to the most improvement. But what about the probiotics? Because, so here's an interesting bit of context. When you came in today, you said, I was 100% last time we spoke, and now I'm still doing great. I'm maybe 95, which is still great. But you had gone from the probiotics every day to, I think, every 3 days.
Correct.
And come off the gut rebuild nutrients powder, which is what we want to do. We want to figure out the minimal effective dose, but sometimes to figure out the minimal effective dose, you take not enough of a dose, and some symptoms kind of start coming back a little bit. So anything else to share there with these other supports and things that you've noticed in terms of, do the probiotics seem to be aiding in any unique way, or any feeling on those?
Well, the whole package really helped in the beginning, and just recently I've noticed that kind of gave very, very minimum symptoms coming back, and that's what we discussed. So I would definitely go back and try more probiotics again.
And had you also, I believe you had said, sorry, I'm trying to remember all the chart notes here. Had you also backed off your dose of the acid at the same time?
No, the acid was.
So the acid's been constant,
yeah.
And the probiotics have decreased to once every 3 days from once every day, and the gut rebuild nutrient powder is now gone. So, I think patients, they have more power in their hands than they realize sometimes, if we can just try to isolate these variables. So now all we're going to do is go back on the full program, wait a few weeks until symptoms seem to be back to that 100%, and then try to reduce these kind of one at a time, and that makes it a little easier to kind of tease out that cause and effect. So that's kind of the synopsis, but we really see here, if you can be strategic when you use hydrochloric acid, and for the clinicians, you really want to see a notable symptomatic improvement, and that's what we should be looking for. You can have great results. And then another awesome example of the gut-skin connection, and this is something we were talking about a moment ago. We're just scratching the surface on the gut-skin connection, and there are sometimes skin lesions of various sorts that we don't even have a name for, that you may see improve when you improve someone's gut, or that have no known treatment that you may see improve. So I don't want to oversell that case, but certainly if you're having skin issues, one area to consider is your gut. And there's the old naturopathic saying that the skin is a reflection of the gut. And so in this case, an added bonus that we weren't even expecting to see.
Right.
Anything you want to kind of leave people with and close?
I've been very happy with the treatment plan. It's changed my life. So
awesome. Obviously, I'm thrilled that you're doing so well. And for those watching this, don't underestimate the power of some simple things, like a hydrochloric acid supplement that you could buy online may actually be more effective than a PPI from a gastroenterologist. Again, always check up with your gastroenterologist. It's not to say don't follow the recommendations, but don't be shy about getting a second opinion, because in your case, boy, itchy reactions and minimal changes in your symptoms with one approach. And if we go over to a different camp of thought, turns out that was a much better fit for you.
Right.
Awesome. Well, thank you so much. And I'm glad you're feeling so much better.
Thank you.